Hi, Dr. Ron Ehrlich here. One of the most common questions we are asked is, what is a holistic dentist? And the answer is simply this, that the body works as a whole. The planet works as a whole. We are not compartmentalised up, even though we have specialties, and even though our focus is very much on the oral cavity and on oral health. But a holistic dentist recognises that we need a holistic model of health to work in and understand our role in that model. And the holistic health model that we have used in our practice for over 30 years is to see the body, our lives, if you like, and our health as a question of balance. And many people would acknowledge that stress is an important aspect of our modern life and it affects us in negative ways. And we would define a stress as anything that compromises the immune system or promotes chronic inflammation, because chronic inflammation is the common denominator in all diseases. So to that effect, we have always had a 5 stressor model and recognised that if we're going to identify and minimise stresses, we need to have a structure to think about that, either professionally or personally. And so those 5 stresses are emotional, environmental, postural, nutritional, and dental stress. And people are often surprised by the dental stress, but we include it for 2 reasons. One, because we have been doing this for over 40 years, so we feel reasonably well qualified to comment on dental stress. And 2, we include it for anybody with a mouth who is interested in their health, but has never fully connected the two. Dental stress includes oral infections, biocompatibility of materials, potential toxicity. It includes breathing and sleeping, because the shape and size of your mouth determines the shape and size of your upper airway, and that predisposes you to breathing and sleeping problems. Also, chronic pain. It's such a sensitive area that if you clench or grind your teeth and things are out of balance, it can be implicated in headaches, neck aches, and jaw pain. So they are the 5 stressor model, and we will be sharing some of that information with you. We already have spoken about postural stress as well, even though our focus is primarily in the oral cavity. We are dentists. Now, if you're trying to, on the one hand, identify and minimise the stresses in life that compromise your immune function and promote chronic inflammation, the other side of the balancing beam is to try to build resilience. And to that effect, it helps to have a structure to think about it. And to that effect, we have five pillars of health: sleep, breathe, nourish, move, and think. And obviously, we are what we eat. Nourish is very important, but the foundation of good health is a consistently good night's sleep. Sleeping and breathing are the foundational pillars on which nourish, move, and think are built on. And the whole balancing beam of 5 stresses and 5 pillars of health pivot on your genes and how your genes express themselves. That is called epigenetics. It's a whole new science of how all of those factors affect the way your genes express themselves. So that's the holistic health model that we have worked with philosophically when we think about things in our practice. Even though the vast majority of our work is done as a dentist would do work, we think about what we're doing very differently, and we work with other health practitioners to try to improve our overall health. Now, in the coming weeks and months, we will be sharing more of that information about those 5 stressors and those 5 pillars with you. I hope that helps answer the question, what is a holistic dentist? And I hope this finds you well. Until then, be well.